Meanwhile, there are other health stories making headlines this week, and joining us now to talk about them, our Morning News medical contributor and Northwestern Medicine physician, Dr. Lauren Streicher. Thanks for being with us.
Good morning.
Good morning. Good morning.
So we start with new recommendations for lung cancer screening.
Yeah, this is important because lung cancer is still the leading cause of cancer death in men and women in the United States. And right now, despite the current screening programs, only 25% of lung cancer is detected when it's at its early stage, and of course, the most treatable. So that means the majority of lung cancers are being diagnosed when someone comes in with symptoms. At that point, it's already late in the game. So there's a big push to improve the screening process and pick up lung cancers early. And new guidelines were just released by the U.S. Preventative Services Task Force. So I want to be clear, these guidelines apply to smokers because while anyone can get lung cancer, 85 to 90% of lung cancers do occur in smokers or former smokers, making them the really high-risk group that's going to benefit most from the screening. So here are the new guidelines. For one, a yearly low-dose CT scan, not a chest X-ray, is recommended as the best way to pick up early small cancers. But the biggest change is the age at which annual screening should start. The old guidelines said screening starts at age 55. Well, now it's 50. 50 is when screening should start. And the old guidelines said you need 30-pack years of smoking. The new guidelines say no, 20-pack year history of smoking is when screening should start. So that's either 1 pack a day for 20 years or 2 packs for 10 years. But I want to be clear, these new guidelines are for smokers who have no symptoms. I mean, anyone can get lung cancer. So if there are symptoms, smoker, non-smoker, whatever your age is, if you've got a persistent cough, shortness of breath, wheezing, check out those symptoms. Don't wait to be screened.
Gotcha.
All right, and added benefit of birth control.
You know, when we think about the benefits of birth control, I mean, obviously everyone's thinking about preventing pregnancy, but you also sometimes think about things like reducing cramps or lowering the risk of ovarian cancer, but you generally don't think about birth control pills preventing medical problems that have nothing to do with gynecology. And it turns out birth control pills might curb asthma attacks. Birth control pills might help female athletes with concussions recover faster. And it sounds crazy, but it's actually not as crazy as it sounds because estrogen has long been known to influence, for example, the severity of asthma. If you look at kids, asthma is more common in boys, but after puberty, it's more common in girls. So in this study, just over 80,000 women over 17 years, women that used hormonal birth control, pill, ring, patch, any of those for more than 3 years had a significant decrease in severe asthma attacks. And this concussion connection is also really interesting. This was released in a study yesterday out of Northwestern University that they found that women athletes who had concussions, who were in the second half of their menstrual cycles, got better quicker. They were less symptomatic. So they started looking at women athletes who were on birth control pills and found that they got better quicker and were less symptomatic than women who weren't on birth control pills. So the important part of all this is not that women with asthma or female athletes who might get concussions should go on birth control pills. The important part is that it's telling us the impact of hormones like estrogen and progesterone on a lot more than just reproduction. So need more research on that one.
All right, there are concerns also that the COVID vaccine causes infertility. Any truth to that?
Oh my God, no. I mean, it's crazy talk. The COVID vaccine does not impact on the ability to get pregnant, but you wouldn't know that if you spend a lot of time on social media.
Well, where does that report come from?
Well, it's part of this bigger disinformation campaign, and that's the point, is that there are a lot of people putting out things like the vaccine's going to give you COVID, or the vaccine's going to alter your DNA, which is not biologically possible, by the way. Or the biggest one, I mean, you've heard this one, the vaccine can implant a microchip that can be used to track or control the population. So this is all intentional disinformation, which is an effort to increase distrust and fear of the vaccine. And it's just not true. You know, this one about infertility, what they say is that there's a protein on the vaccine that's going to interfere with development of the placenta so that not only will you be infertile, but if you get pregnant, you'll miscarry.
Has come out and said this is crazy talk. And I just want to say, you know, I mean, every nurse, doctor, healthcare professional I know, they all are getting the vaccine. And we wouldn't be sticking out our arms to get the vaccine if we thought that it wasn't scientifically valid and all this stuff is true. So talk to your doctors. Don't believe what you're finding on the internet.
All right. Dr. Streicher, thanks for joining us.
Are we losing her signal there? I think we lost her a little bit at the end there. Thank you so much for being with us. You can check her out on social media and also go to drstryker.com. Have a good day.